So good morning or good afternoon or good evening, wherever you are. My name is Leah Van Wy, and I am the Dean of the School of Professional Studies at Brown University. And we provide support for master's students and master's programs all across campus. And so we are here today to answer questions about arriving on campus, what it's going to be like on campus, courses, life in Providence, anything that people are worried about coming into campus this fall. And so there were a number of questions submitted ahead of time, and there were kind of three big groups of questions that I wanted to talk a little bit about before we take live questions from folks who are watching. And so the first one is about what it's like to arrive in Providence. So what do you have to do on arrival? Do you have to check in? Those sorts of questions. The second one is about course registration and how that process is working this year. And then the third is about getting involved in research and what's happening on campus in terms of research. So I'm going to speak a little bit about each of those. And as I'm talking about it, Jillian, who's the Director of Communications in the School of Professional Studies, is going to drop some links into the chat window for you all to be able to follow along online if you would like. So I know that some of the guidance that's gone out has had a lot of different processes for arriving on campus and testing and all of those sorts of things. So I want to talk a little bit about what this is like for master's students arriving. So you are all arriving from somewhere else. Maybe you're already in Providence. Maybe you're arriving in Providence in the coming days or weeks. As you arrive in Providence, you will be living in housing that is not dorms on campus. So even if you're living in Brown auxiliary housing, it's not on-campus dorm housing. And so when you arrive, in terms of quarantine and testing, you need to follow the Rhode Island Healthy Travel Guidelines. And so Jillian's going to throw those in the chat window. The basic setup right now is that if you are coming into Rhode Island from somewhere that is not at a very low level of community spread of COVID-19, what you'll need to do is either provide evidence of a negative test within 72 hours before traveling, or you will need to quarantine for 14 days in Rhode Island before you go out and go to the grocery store and meet your friends and go out to restaurants and those sorts of things. Or you'll need to pursue a COVID test immediately upon arriving in Rhode Island and then quarantine until you get the results of that test. So all of that information is on the Rhode Island Health Department link that Jillian's put in there. And so that's the kind of arrival in Rhode Island. Campus right now, the only things that are happening on campus are essential research activities and then folks who are getting ready for students to arrive, so facilities and those sorts of things. So there's not very much that you're going to want to or need to do on campus until September 16th. So you're going to arrive in Rhode Island, and then as the semester begins in the week of September 9th, what will happen with you in terms of testing is that you'll be entered into Brown's asymptomatic testing pool for COVID. And what that means is that you will be entered into the system. You will need to arrive on campus for testing at a different level of frequency depending on how often you're on campus. Now, the vast majority of you are going to be taking courses, so you're going to be on campus very regularly and have pretty high levels of contact with folks on campus, which would put you in the twice a week asymptomatic testing pool. And this is testing that's provided at Brown's cost in a Brown facility, so you don't need to worry about setting any of it up. So you'll be enrolled in the testing program, and you'll receive a communication that says you need to show up for testing on this day during this week. And there will be an online form that you can fill out where you type in like what time you want to do it, and then it will send you a 15-minute window to show up. And so we're trying to keep people in 15-minute windows so that there aren't a whole lot of people showing up and waiting in line, because that defeats the whole purpose of having people de-densified on campus. And that testing will happen in the Olney Margolis Athletic Center. So that's on the north side of campus near the fitness center, if you're aware of where the fitness center is. And so that's what will happen as you start coming to campus in the week of September 9th or the following week to meet with people and to come to classes. So your entry into the testing pool into not on campus at all, and therefore not in the testing pool, on campus 1 or 2 days a week, and so being tested once a week, or on campus 3 or more days a week, which means being tested twice a week, your initial status in that testing pool is determined by what you said on the location survey that we sent you last week. And if you haven't filled that out, please fill it out now and we'll be following up with you. So that form gives the initial status for being in the testing pool. The other thing that's going to happen as you arrive on campus is that you will need to sign a student commitment to follow the policies that Brown has put in place to prevent the spread of COVID-19. And Jillian, do you see the link for that, the student commitment? I think I might, yep, okay. So there's a student commitment. It's a form you need to sign. The link that Jillian's just put in the chat will show you all of the different things that you're committing to. Everybody is committing to those things. So if you're worried about other people's behavior as well as your own behavior, you can see what other people are committing to there. So that's the basic kind of arrival on campus and getting started in general. And beyond that, you need to be in touch with your programs to see what program-specific activities are happening. There also will be a virtual orientation that the graduate school will be running, and I don't have the date on that on the top of my head, so maybe Jillian can look that up and put that date in the chat as well. So that's the physical arrival and getting started on campus piece. The other thing that a number of people had questions about was with the registration process. And so the registration process was done somewhat differently this year than in the past. So in the past, it was everything open, everything was first come, first serve. And this year we had you put courses that you were interested in your cart. And right now the registrar is doing a matching process to ensure that people get the courses that they need and that they have the highest priority to get courses that they want that are oversubscribed courses. I'd be happy to answer specific questions on that process. Let me just give you a few numbers. There are about 75% of the courses that are on the books in courses at Brown are not oversubscribed based on what are in people's carts. And so those are courses that if you put them in your cart, you will definitely get them. So there are a little over 350 courses where more people want them than seats are available. And those will be matched with people based on a priority list. And so as graduate students, you all have a higher priority than some of the undergraduates. And the goal is to get everybody into at least one of the courses that is oversubscribed that they're interested in. And I could give you a little bit more information about that if you would like. The important thing to remember is that there are sort of 3 moments to get the course that you want. So you put things in your cart and there's this matching process. And then starting Monday, there will be, so you'll get the outcome of the matching process and what's in, like which of the things in your cart you got into on Saturday this weekend. And then on Monday, the drop add period begins for graduate students. And so during that period, you'll be able to look around at the courses that are in your cart, other courses that are still open, and be able to drop things and add things. And you have 48 hours to do that before most of the undergraduates are able to do that. So you'll be able to do a bunch of dropping and adding on Monday. So that's the sort of second phase of adjusting what courses you're taking, should you wish to do that. And then the third phase is Brown's shopping period. And the shopping period at Brown is unique as far as I've ever seen anywhere in higher education. And so we have a period at the beginning of the semester, and it goes through September 22nd, in which you can attend any classes that you want virtually at this moment. You can see if you like them, you can see if you don't like them. People drop a lot of classes and add a lot of classes, so there's a lot of turnover. So if there's something that you want that's in your cart and you don't end up getting it on Saturday, there's a pretty good chance that you'll be able to get it during the shopping period. So that's something that is relatively unique. That shopping period will be virtual for September 9th through September 15th. So no classes will meet in person September 9th through 15th, but you will be able to attend any of the classes that are in your cart at that moment, even if you're not registered for them. And so you'll be able to assess whether you'll be able to get into them, whether they're the right course for you, and things like that. And then the last date that I want to mention here on registration is September 22nd. And so September 22nd is the end of the drop add period without paying a late fee. And so by September 22nd, we hope that all of you have gotten the courses that you want and are able to adjust your schedule the way that you would like it. So, okay, so that's arrival and then registration. And then the third piece that I wanted to talk about that was a general question that a number of people had was about research. And a number of people were interested in whether they could get into people's research labs. So Jillian's going to pop in there the Resuming Research webpage. So Brown University is at stage 2 of resuming research. And so what we are doing is starting up research activities a little bit more slowly than the state of Rhode Island. So the state of Rhode Island opened up and then pulled back a little bit, but we didn't have to pull back on where we are on research because we were being a little bit more conservative than the state. And so the kind of basics of stage 2 is that laboratory research, all essential laboratory research can happen. Undergraduates and graduate students are able to be in the lab. The space constraint is that there needs to be one person per 150 square feet of lab space. A lot of labs are organizing shift work. So if they have too many people to meet that density requirement, they'll have some people come in the morning and some people come in the afternoon or alternate days. So the vast majority of the research enterprise has restarted. Field research has restarted. So if you're coming in and you want to be able to go out and collect plant samples or animal samples or things like that, there is the possibility of doing that as well. There is each individual PI, each individual faculty researcher has developed these plans for their research group. So if you're interested in joining a research group, you'll need to approach the individual PI to understand whether there's capacity in their research group, both from a faculty attention perspective and also from a space perspective in the lab planning. So, so I think those are the big overarching things that I want to talk to you all about. And then I want to open it up to questions because I believe those things that I said addressed all of the general questions that people had shared ahead of time. So let me open it up and see what people's questions are. Or I can keep talking if people don't have questions.
So if anyone does have questions, they can use the Q&A feature in Zoom to submit your question.
While people are thinking about questions, oh, there's a question. Will the gym and pool facilities be open for students to use throughout the year? Our athletic facilities, our recreational facilities are currently not open, and we are hoping they'll be able to be open sometime later in the year, but they're currently not open because there's no way to ensure people's safety. That's indoor exercise is one of the riskiest activities for COVID-19 transmission. So I saw, there was one question that was submitted ahead of time about other sorts of campus facilities. So there were two questions about whether there would be spaces on campus to participate in remote courses if you weren't able to do that in your apartment. And then also just general questions about campus facilities. So campus facilities will not be open on September 9th because we have this quiet period from the 9th through the 15th. But after that, the library will be open. The library is instituting a reservation system for all spaces, for all study spaces in the library. So they have de-densified the study spaces and put out individual marked stations either in the carrels or in open study areas. And those will be reservable for up to 2 hours at a time. And so after September 15th, those will be reservable and you'll be able to use those study spaces. In addition to that, a number of departments are planning for graduate student space in their return to campus plans. And so there's a fair amount of that happening at the department level, and it varies dramatically across departments how much space they have. And so what I would encourage you, if you're worried about this, if you're worried about access to quiet space or access to good internet to be able to do your remote coursework, then I would encourage you to first check in with your program. And if they don't have space, feel free to send me an email and we will try to manage something centrally. This is something that we're trying to assess the demand so that we can come up with an appropriate response. So if you have any need for that, you can send an email to spsdean@brown.edu and we'll be able to follow up and talk to you about that. So I see a question here about the insurance. So yes, the insurance, so the premium for the student health insurance plan is a full year premium. And if you graduate in one semester, the insurance does cover you for the full year. You don't have the option of a shorter term coverage. And so yes, you do need to, you will be covered for the full year. Job opportunities for graduate students, those are very departmentally specific. And so there's a student job board that you can take a look at. I don't have that link off the top of my head, so we'll try to find that link later and get it to you. There's a student job board that posts jobs for undergraduate students and graduate students. A lot of job opportunities go through your department. So the first place to start is with your program director, and then the second place to go is that student job board. And then if you're unable to find something there, we could try to see if we could do some sort of matching process, but in general, that's done very organically. And so I see another question here about, can students use the printer station? That's gonna also vary from department to department. So most departments have graduate student space where people can use printing. And if that's not available in your department, it will be available in the library. I see one question then about food access programs like the subsidized market share. I don't know the answer to that question, so I am going to make a note of that and find out the answer to that. And we can post it on an FAQ later. So then there's a question here about whether there's parking for graduate students. There is generally not parking available for graduate students. This year, however, there is very limited use of on-campus parking lots because staff are not coming back to it. Unless it's essential for them to be on campus, the staff are not returning to campus until after the winter break. And so there's actually a fair amount of parking available on the street and also in brown lots that are being underutilized. So we'll put a little bit more detail and a link to the parking office in an FAQ on that one after this. So there's a question here. Dean Campbell mentioned that the School of Professional Studies is developing a half-credit tuition-free course in professional development that will be delivered in a hybrid format. Can we take all online courses in our department and consider this course as hybrid to take care of SEVP regulations? That is our hope. That's our plan, is that this will address the SEVP regulations. We can give you a definite answer on that a little bit later today. We're doing a little bit of consulting with outside legal counsel to make sure that that is accurate. If it doesn't, we will come up with another solution for you. That we are committed to making sure that there is a hybrid course so that if you have to take all of your required courses online, there will be something that meets those regulations. And my plan is for it to be this professional development course, and we're just kind of dotting the I's and crossing the T's. Okay, so I see another question about following up on parking, not seeing any parking permits available. So what I'm gonna do is I'm gonna follow up directly with the parking office, and I will post something on the graduate school webpage, on the School of Professional Studies webpage about about the process for doing that and what's possible and what's not possible. Because in a standard year, when there are a lot of staff parking on campus, there are not graduate student parking permits available, but this year is an unusual year, both in the sense of there being a lot more space available on campus because the staff aren't on campus, and also because of people having much higher concerns about public transportation because of COVID transmission. So I will follow up directly with the parking office on that. What else can I tell people? Jillian or Connor, can you answer that question?
Yes, we're recording the webinar, so it will be available afterwards.
Do you know where it will be?
That is a good question, but we can email all the attendees with the link once it's available.
Great. Connor, do you want to say something about that? It said that you wanted to answer the question. Nope. All right. Well,
I was just getting it out of the way. Sorry about that.
Okay. All right. We'll make sure that it's emailed to everybody. So there's a question here about COVID testing. Once you arrive on campus, you arrive in Providence and the semester starts, you'll be able to get asymptomatic COVID testing at the OMAC, the athletic center on campus. If you're symptomatic, you should go to Student Health Services immediately and you can get the testing there. If it's before you travel, it would have to be somewhere where you're located right now. So it's, is the question about in Providence after you arrive, or is the question about where you are right now? Okay, so in Providence, then if you're already in Providence and you're a graduate student, you should be able to get the COVID testing on campus. And the testing site currently is at 225 Meeting Street, which is across the street from Meeting Street Cafe. And after that, it's going to be moving to a larger facility in the OMAC, the only Margolis Athletic Center. So, so Jillian, actually, while people are talking, can you look up the contact for that if people are in Providence right now? So there's a question here about whether we need to get tested on a week that we don't plan to actually go to campus. And so this is a really good question, and this is a challenging situation for us. And so let me tell you what the plan is. We absolutely do not want people just to come to campus to get tested, because that would defeat the whole purpose of being able to be tested and de-densification of campus. However, we have 3 statuses in the testing pool. Totally off campus, in which would mean you don't get tested, but you also never come to campus. So if you wanted to be in that status there and you needed, for example, library resources, the library is doing distance circulation, so doing curbside pickup of materials. But if you're in that fully off campus status, you don't get tested and you don't come to campus at all. And then we have the once a week testing status, which is limited contact, but you are coming to campus. And so if you're in that, you do need to come to campus to get tested. And then we of course have the twice a week testing for the people who are on campus a lot. And so if your status varies dramatically from week to week, it's going to be challenging for us to manage that. But what our plan is right now is that we will move people in and out of the different parts of the testing pool on a weekly basis based on updates that they submit to their programs. So the programs will be managing people's location for the purposes of testing in our graduate student information management system. And so if you are planning to move from I'm on campus at least once a week and so I can do the testing once a week to I'm not coming to campus, then you need to let your program know. And so it's going to be very difficult for you to move from week to week back and forth between statuses. But if you say, okay, I'm going to be on campus every week for a month and then I'm going to be totally off campus, that's going to be easier for us to manage. But moving back and forth on a week to week basis is going to be very problematic. So there's some questions about the address of the testing facility. I'm going to let Jillian put those in the chat or point us to the FAQs or other information on that. The COVID tests, so we are, some of you may have heard that we had, among the folks who went back to do research on campus this summer, we had problems with response time. And we are moving to a different provider of the testing. And so we are not anticipating the long response times. The expectation is that the responses will be within 24 hours. So we're working with a lab facility that's been doing this for quite a number of other universities and private organizations and state organizations. And so we'll get responses within 24 hours. In the questions that were submitted ahead of time, somebody wanted to know whether it was an antigen test or a PCR test. It is a PCR test, so it's not the kind of rapid response test where it takes 30 minutes or something like that. It's a 24-hour turnaround, but it is a PCR test. The testing, so there's a question about whether this will be scheduled individually or whether the department schedules it. The individuals will schedule it, so you'll be entered into a testing pool that's managed by the Division of Campus Life, and they will send messages to you that say you need to be scheduled and give you different windows of time at which you can schedule it, but it will be scheduled individually by you. So yes, so it says the testing begins August 24th, and if you're already in Providence, then if you're already in Providence and you're an enrolled student, then you should be able to contact Student Health Services, and they should be able to help you arrange a test before August 24th. If you are, if you're not, well, no, there's not if you're not. You should be able to contact Student Health Services and they can help you get enrolled in the testing. So there's a question about PPE, masks, and hand sanitizer. So yes, every individual coming onto campus, every student coming onto campus is going to be provided with reusable face masks that are to be washed between uses. So everybody's provided with 3 face masks. There are hand sanitizer stations all over the place. So, you know, if you don't want to carry the hand sanitizer around with you, it's available. I believe that there will be individual hand sanitizer, small bottles of hand sanitizer given out to each student as they arrive on campus. There are some situations in which people want more complete PPE if they're doing work with biological specimens, or if they're doing work that is a little bit closer work in the lab, and so they're not able to necessarily follow the 6-foot social distancing. And in those cases, that would be organized through your lab supervisor, through your PI. So there's a question here about picking up brown student ID cards. And this is a question that I thought about this morning in the shower and did not have the answer to. And so we will follow up on that and get that answer back out to you. Because as you say, the campus is opening a little bit later, but a lot of you are already here. And so we will find out the answer to that and get back to you. So there's a question about if we've already arrived on campus and we can pick up our mask and sanitizer, that the distribution should be happening through departments. And so you should be able to talk to your department about that. There's a question about contact tracing protocols and procedures. So there's more detail about that on the Healthy Brown website. So Brown has its own team of contact tracers who have all gone through training that was offered by Johns Hopkins. And so should you, and they're working in partnership with Student Health Services. So should anyone test positive or have symptoms of COVID-19, they'll get in touch. You will need to get in contact with the health services, and then the health services will initiate the contact tracing. And the contact tracing will be done by Brown staff that are trained to do contact tracing. And so one of the things that you're committing to in the student commitment is to keep a log of your contacts and keep a log of where you've been. And you know, you can do that with an app, or you can do that offline. If you're in a laboratory, that's being done centrally by Google Sheets that are doing check-in and check-out in laboratories. And so you're committing to keep the information that's necessary so that should you test positive, our contact tracing team can follow up with you and find out your contacts. So there's a question about getting the COVID-19 test after paying the tuition. There's no real relationship between paying the tuition and getting the test. The test is really about arriving on campus and arriving in the Brown community. And so the tuition needs to be paid on time before classes start, and then the testing needs to happen before you start coming to campus and enter the community. There's a question about technology being used for aiding the contact tracing. At the moment, that's not part of our plan. I know a lot of places are, not a lot of places, a number of universities are instituting technology that uses the information, your cell phone logging into Wi-Fi and kind of moving around campus to do contact tracing. We're not doing that for a whole variety of reasons. And so right now we're relying on people, to keep those contact logs. So there's a question about confirming that student health insurance coverage will begin this Saturday, August 15th. I do not have this date in my head. So Jillian, can you take the student's name and send an email to Cheryl Moan in the insurance office so that she can confirm that for for the student here? I don't want to say anything wrong, and so I believe the answer is yes, but I want to make sure that the experts answer that. So there's a question here about whether Brown is going to be assisting with Wi-Fi, as so many students must use their own instead of working on campus and TAing at home. So we've discussed if people need to TA or if people have insufficient Wi-Fi, so not fast enough Wi-Fi at home to do what we've been doing with the undergraduates, was just providing Wi-Fi hotspots for them. So if you are already in Providence, or you arrive in Providence and you find that your Wi-Fi and your internet connection are inadequate to do the work that you need to do, go ahead and reach out to me, because I don't know the contact of who's organizing that, but you can reach directly out to me and I will put you in touch with the people organizing that. So there's somebody who just joined who was asking about self-quarantine upon arrival in Providence. And so the directions for that are those of the Rhode Island State Department of Health, which are in, I believe, one of the very first links that are in the chat window. Jillian, can you put that in again in case they can't see the earlier links when they join later? Yeah, so there's documentation that needs to be filled out for the state, not for Brown University, but for the state, and there are instructions on exactly how to do that. There's a question about paying tuition, about can we only pay with electronic payment and mail, or can we pay it in person? All of our administrative employees, unless they absolutely have to be on campus, are working from home, and in order to allow us to actually bring students to campus. And so there's not an in-person payment option at the moment. So the question about the tuition and how it relates to the classes. So it varies a little bit from program to program, but in general, the tuition is more expensive if you take more classes. So in general, we have a per class tuition, but it varies a little bit from program to program. And so to be absolutely sure, you should contact your program administrator. If you can't get a clear answer from them, you can contact us in SPS. So to spsdean@brown.edu, and we would be able to answer that question for you with the information about your specific program. Capacity of the hospitals in Rhode Island. So somebody just put a question in the Q&A about the capacity of the hospitals in Rhode Island. I don't know exact numbers on the capacity off the top of my head. They're available on the Rhode Island Department of Health website, COVID website, about what the current usage is and the current capacity is. I know that we're well below our maximum capacity. And in fact, in the kind of height of the COVID epidemic over the summer, the first wave over the summer, we never reached the hospital capacity and we set up an additional field hospital, but we never had to use it. So the hospitals have plenty of capacity. So, so there don't seem to be other questions right now, but I'll just say that Providence is, if you're not already in Providence, Providence is a really great city. There's a lot of great places to eat, and the places where you might need to quarantine, there's lots of food delivery, and it's a lovely place to live in the fall. I'll also throw out there that we, if you didn't see the announcement, we have some housing available on campus. So there's more capacity on campus with not dorm housing, but with what is usually visiting scholar housing. But since we're not having any visitors this year, like faculty visitors this year, we've made that housing available to graduate students this year. So if you didn't see that announcement and you're still looking for housing, we have some of that housing available. What else are questions that people have had recently? There's just to reiterate some of the things that came out in the president's announcement earlier this week. The undergraduate students are delayed in their in-person start, at least delayed until October 5th in their in-person start to classes. But graduate students are expected to be able to be in-person, hybrid classes, or online as they wish and as their faculty wish, starting from the end of that 1 week quiet period, the 9th through the 15th of September. So after the 15th of September, the expectation is that graduate students will be able to participate in person in courses that are hybrid, participate remotely if they prefer, and really fully participate in the life of the campus. Go to the library, go to the student center. So so it will be a bit of an interesting first 4 weeks of the semester because the undergraduates will not be in the classes and not as much on campus, though there still are expected to be about 750 undergraduates on campus because these are students who are petitioning to be able to come to campus early because they have some sort of hardship at home where they can't find a quiet space to study. It's not a safe place to be. So there's a little bit of petitioning. So there'll be about 750 undergraduates who are in dorm housing at the beginning of the semester. And then there will be roughly 2,500 graduate students who are on campus doing research and taking courses if they would like. So there are a couple of questions coming in. So the first question is, does Brown provide IT applications like Microsoft Office Suite and Adobe Acrobat at discounted cost for students? And yes, the link for all of the software that's available to folks at Brown is software.brown.edu. And there is free access to Microsoft Office, free access to Adobe Acrobat, and there's a whole long list of software that is either free or available for use on campus, but not available for download. So there's a great set of software there. There's a question about support for students who contract the coronavirus in the midst of the semester. So yes, there will be support for that. So Health Services will be the health provider for students who contract coronavirus in the middle of the semester. There is also support through the graduate school in the form of, and the School of Professional Studies in the form of kind of emergency funding. If there is some need some need for emergency funding that can't be met. We're working on procedures for what happens if people are unable to complete their courses. And so I would say that there is going to definitely be support, and it will be decided on a case-by-case basis, depending on which forms of support each individual needs. And so if this happens to you in the middle of the semester, the first place to start is Health Services for the health treatment, and then Maria Suarez in the graduate school, who's the Associate Dean for Student Support. And so she'll be organizing any sorts of medical leaves that people need, or temporary medical, not leave of absence, but just accommodations in their classes or something like that. So we'll do that on a case-by-case basis. So there's a question about the course matching process. So when the course matching process occurs and we get the confirmation email, will we need to confirm this course selection? And what if we're not happy about it? So you will not need to confirm it. You will need to actually go into either Banner or Courses at Brown to be able to see what you got. And that is effectively a confirmation of it. And if you're not happy with it, so there's a question here, if we're not happy with the course match, do we need to reach out to our program director to understand the opportunities to get into other courses? And yes, that's where you would start. You would reach out to your program director. So there's a question here about office space. Would we be assigned and able to use offices this fall? That varies dramatically from program to program. And so first reach out to your program. And if you're not able to find what you need, then we can try to solve something centrally, but in general, that's solved locally at the program level. So there's a question here about, can you talk more about library access and the process of borrowing books that are not available online? So right now, the library is in the process of digitizing everything that is needed for courses. And so that all of those will be available for digital borrowing. If there's something that you need to borrow that's not available online, they will have a curbside pickup. So it will be a distance, they're calling it distance circulation. And so you'll be able to request a book and there'll be touchless pickup and touchless return so that you don't need to interact with the library staff. And I think Jillian just popped a link into the chat so that you can see a little more information about that. So in general, the university is going through all of the services, or has gone through all of the services that we offer, and made as many of them as possible available remotely. So we have student health consultations where it's possible to do teledoc visits. We have student health services available remotely. We have counseling and psychological services remotely. We have student support available remotely. We're doing this distance circulation and digitizing library materials to make them available remotely. Folks are doing academic advising. Your advisor may meet with you by Zoom rather than in person. So we're trying to do as much remotely as possible. And then at the program level, we're doing community building activities largely on Zoom, but all the programs are working hard to try to figure out how to build community without necessarily bringing everybody together. And there'll be a graduate school virtual orientation as well. So somebody's just submitted a question about bus services. So will transport services be available as usual? And yes, for those of you who don't know, all of the Rhode Island buses, the Rhode Island public transportation system is all on one single system, and it is free to ride with a brown ID. So you get on with your brown ID and swipe it instead of a bus card. And the Rhode Island system is running as normal. There are social distancing requirements and mask requirements on those, but those are running normally. Brown University also runs a shuttle service that goes between the medical school and other things in the jewelry district and the hospitals and the campus up on the hill. And that shuttle service will be running. We also run special purpose shuttles in the evening for people who are on campus and need some help getting home safely. And we also run special shuttles for people who need disability support. So all of those will be running normally. And the shuttles the Brown University shuttles are relatively small. And so we'll be adjusting the frequency to meet the demand so that people can both social distance, but also get where they need to go. So there's another question that just came in about picking up ID cards if we don't anticipate being on campus this fall. That's a very good question. And I do not know the answer to that. And I will find out the answer to that. So Jillian, can you make a note of that so that we can find that out at the card office, and we will post this on the graduate school and SPS web pages under an FAQ section, but we will find out the answer to that because it's a good question about how you're going to pick them up if you're not on campus. There was one question I remember that was submitted that was a very specific question, but I'll just throw out the answer in case it's relevant to other people. There was one question that was submitted regarding courses that were required courses but were not available in courses at Brown. And so yes, so everything that is in courses at Brown is everything that is going to be offered. And so if there is something that you need to take or you want to take that is kind of in the course list that's available on your program's website but doesn't show up in courses at Brown, you'll need to contact your program director to figure out what your strategy is on that, because there's nothing that hasn't shown up yet in courses at Brown. Everything is there. So there's a question whether OISSS will be available in person. OISSS is operating remotely, and so you'll need to reach out to them to figure out what you can do remotely and whether there's a need to meet in person, because I believe that they're doing everything remotely and can do everything remotely. There's a question about whether there's a backup plan for cases when cases increase mid-semester. We are planning for cases, so we believe that we have all of the foundations laid so that cases will not increase mid-semester. So we're bringing people back slowly in phases. We're doing the twice a week asymptomatic testing so that we catch people before they're able to spread to other people, So we catch people before they're symptomatic, but after they might have been able to start spreading. And so we believe that we're going to actually keep the spread really under control on campus. So we're bringing the students back. We're bringing the undergraduate students back later. We're bringing the graduate students back now. If anybody violates the student commitment to, not have large parties and not have events where people are not wearing masks, all of those sorts of things, there will be rapid consequences for that. So we believe that we actually have everything in place so that there will not be an increase in cases mid-semester. But of course, we all know that mid-semester or towards the end of the semester, we see the beginning of flu season. we see more people being inside and not necessarily outside. And so we have the potential for there being more spread. And so yes, there is a backup plan if that happens. And the backup plan is going to be kind of pulling back on the level of presence on campus, pulling people back into like doing more remote learning. And so all of the faculty are preparing for their courses to be able to be delivered hybrid, in person if they're able to deliver them in person, or online if they need to deliver them online. And so the plan is just to be able to pivot very easily between remote learning and in-person learning. So that's the plan on the course side. On the research side, everybody has a clear step back to stage 1 plan, and the research is driven by what the state of Rhode Island is saying, a little less on what's happening on campus. And so so there's definitely a plan for if cases increase in the middle of the semester. So I hope that answered the question there. So there's a question here. If we plan to come to campus 2 days a week for in-person classes and require weekly COVID testing, will we need to come to campus to be tested prior to our class time? So no, that the point of the asymptomatic testing is to do regular testing, catch people who might be infected before they're exhibiting symptoms, and also to understand the baseline prevalence in the Brown community. Because just as the baseline prevalence in any community determines the extent of any lockdown measures, of any restrictions, we are seeing the Brown University community as a smaller community. And if the community prevalence gets to a certain rate, I don't know what the cutoff is off the top of my head, but if the community prevalence is getting higher, then we'll adjust the restrictions on campus. So the asymptomatic testing is less about catching you and saying that you are not sick at the moment of your class time. It's much more about catching you if you happen to be sick before you can spread it to anyone, and understanding the underlying spread in the Brown community. So you don't need to come to campus to be tested 24 hours prior to your class. So there's a question here from someone asking to elaborate on the registration process for new incoming students and obtaining the Brown ID. So the Brown ID is one where we're going to do a follow-up on that and post it on the FAQ page on the graduate school website and the SPS website. On the registration process, so there are kind of 3 stages in the registration process. So in the first one, you put all of your, I hope you all put all of your courses in your cart on Courses at Brown. And right now the registrar and the dean of the college are running a matching algorithm. It's a very complicated algorithm, and I talked to the dean of the college last night about all the parameters. And so he's doing a matching algorithm to match people to the courses that they've put in their cart. And if the courses are oversubscribed, to give graduate students and seniors priority on those courses, and to get everybody into the most number of oversubscribed courses that they can. And so the result of that process will come out on Saturday. And after Saturday, so starting on Monday, there'll be a drop ad period before courses start. And so starting on Monday, graduate students and seniors are able to look for courses that are still open, find those courses, drop courses that they have in their cart now or in their registration now. And then, so they have 48 hours before the rest of the undergraduates are able to do that. And so there'll be that stage starting on Monday where you can drop an ad. And then during the first week of courses, the kind of what we're calling the virtual quiet period. So it's the quiet period in the sense that nobody's going on campus and teaching on campus. And so the first week of classes from September 9th to September 15th will be virtual. You'll be able to, if you have any courses in your cart at Courses at Brown, you'll be able to attend those courses virtually, see if you like them, ask for permission to get into them if you need permission to get into them. And so you'll be able to adjust your courses between September 9th when classes start and September 22nd, which is the end of the first drop of the no fee drop ad period. And during that time, there's a huge amount of turnover. So a lot of people will drop classes, a lot of people will pick up other classes. And so if something is full and you don't get into it when you get your cart results on Saturday, there's a good likelihood that you'll be able to get into it later. I hope that that answered the question. If there are follow-up details, please throw them in here in the Q&A, or send me an email later and we'll follow up. So I'm going to wait like 20 more seconds here and see if there are more questions that come in. If there are not more questions right now, again, feel free to send an email to the SPS dean at brown.edu or to the graduate dean at brown.edu, and we will follow up with answers to your questions. This webinar is being recorded, so if you joined late and you missed the beginning, you can go back and listen to that. We will be providing updates on a few of these to FAQs on the SPS website and the graduate school website. So, awesome. So Jillian threw the email into the chat if you want to send a question there. I'm not seeing any other questions, so I will end by saying that I'm really excited that you're coming, and I look forward to meeting folks, and we will be having a lot of virtual events for career development and student groups and bringing people together and creating community at the School of Professional Studies that are supporting all of the master's students across campus. And I look forward to meeting many of you virtually or in person and to providing support that you need going forward. So thank you. Thank you for participating, and have a great weekend, and be in touch if you have questions.
Thanks so much, Leah. I'm going to close the meeting now, if that's all right.